I am Dr. Balasubramanyam PR, consultant orthopedic surgeon, practicing in Begur, Jayashree Multispeciality Hospital. I mainly specialize in joint replacements, complex joint replacement surgeries, arthroscopic surgeries, and fracture surgeries. I also do spine surgeries. Hip fractures is a very complicated problem in elderly persons because once the hip fracture occurs, the patient's complications will rise, leading to bedridden status, urinary infection, and deep vein thrombosis, that is clotting in the legs, which leads to the heart attack, everything. So it is very, very important to prevent hip fractures rather than treating it. So for the hip fractures to be prevented, the family members as well as the patient should have proper knowledge. That is, the environment in the house should be proper. That is, wet floor should not be there. Always it should be dry. Light should be proper in the bedroom as well as in the bathroom. Majority of the fracture occurs in the bathroom. So there should be railing all throughout the walls in the bathroom so that if they fall caught unaware, they can catch hold of it. And the eyesight of the patients, especially elderly patient, should be proper. They should get it treated properly. And the most important thing is the fracture occurs because of bone is weak. That is because of the osteoporosis. So the patients has to come regularly for the follow-up of the osteoporosis and get treated properly for that. And many elderly patients will not use cane or walker inside the home. Okay, I advise the patients to use a cane or walker when they are alone or weak, so that they should not fall. The first thing is don't fall.